My osteoarthritis was diagnosed a few years ago when I had some meniscus repair. They let me know that there was definitely arthritis in both knees. The right knee was definitely more prominent. And they told me that in about 5 years, I probably would be looking at knee surgery. So let's fast forward 5 years, and the pain in my right knee began to become quite prominent. I was having difficulty with sleeping, going up and down stairs became very hard, and I just noticed continuous pain almost all the time. When it began a few months ago, it almost hit hard right from the beginning, and it made it very difficult for me at work to be able to move around the store. The osteoarthritis and the pain that came with it became difficult for me to move around at home. Um, my bedroom being upstairs, I would have to hold on to the banister and really pull myself up each step, sometimes literally going one step at a time. I'm a caregiver for my elderly mother, so that became very difficult with moving and trying to just run my daily life because there was just constant and continuous pain. So it was very difficult to function.